One of the great fears of some of the medical stakeholders is that they fear that telemedicine will replace them totally in future. But that's not how we see it. We see as telemedicine as amplifying the effectiveness of offline healthcare.
Techsauce Global, sparking innovative thoughts. Something that is up and coming and is definitely exciting is, you could say, technology for health or health tech. We have it coming out in all sorts of different forms. Today, we're going to take a look at one of the premier telemedicine providers in Southeast Asia, and that is Good Doctor Technology. Sawadee ka, you're listening to the latest podcast episode of Techsauce Global Podcast with me, Chawarat Yung Jiranon Arpupe, the Techsauce Global Podcast host and also the global editor of Techsauce Media. Today, I'm very excited indeed to have a chat with Melvin Vu, the Regional Chief Executive Officer of Good Doctor Technology, or GDT, who's speaking to me all the way from Singapore. Hello.
Hey, Kunpupe. Thanks for having me
Hi.
on this podcast.
Thank you so much as well for joining us here online. To get everyone updated, for people who are listening to our podcast now, can you tell us a little bit about Good Doctor Technology and how it got started?
Sure. Good Doctor Technology, we are actually a joint venture between three very big companies, right? Ping An Good Doctor in China, Grab, of course, Grab, almost everyone knows Grab in Southeast Asia, and SoftBank, right? We started operations in December 2019 by launching in Indonesia, right? But what we see is that this collaboration between these three companies allow us to have fast development and excellent delivery in bringing affordable, accessible, and top quality healthcare services through technology innovation. Good Doctor Technology, we are headquartered in Singapore. So we are a regional company. And so what we also want to do is to bring learnings from each country that we operate in and to customize and to suit local markets, right? So in a nutshell, we are a virtual healthcare ecosystem where people in Southeast Asia can access, again, high quality, affordable, quick and convenient services with the touch of a button, right? Instead of traveling and waiting for doctor's consultation. So our app or our services puts not only medical advice, but also wellness program, care and treatment at people's fingertips without leaving their home. So our mission, very simply, is one doctor for every family in Southeast Asia. And as I want to emphasize again, we want to really put affordable, quick, convenient, and effective health services to everyone in Southeast Asia. So that's what Good Doctor Technology is about.
That's exciting. I think that everyone really does want that for the whole region. And we'll go into detail a little bit about the region later. But I just like to ask about, yourself and your background, because having worked with Grab Singapore and scaling Grab's logistics business in Vietnam, Philippines, and Thailand, what made you as a professional join or decide to join GDT? And how have you been able to apply your past experiences with the company now?
Yeah. So I think for me, in Grab, I have held many different positions. Logistics is one. I was heading up taxis as well in Singapore before logistics. And then after logistics, I was doing a little bit of M&A. I think what really stood out in Grab was the ability to understand and find out what customers really want and need. And I think this is what I impress upon all our colleagues in GDT as well, to understand really what our patient needs, what the healthcare system requires, and how we can really improve the health landscape in each country that we operate. I think at the heart of Grab really is about understanding different stakeholders, whether is it driver partners, merchant partners, whether is it the governments, whether is it the users, the riders. So it is the same that I try to bring this to Good Doctor technology as well. But if you think about it, why healthcare? And I think it is really something personal for me as well.
Mm-hmm.
I think, about say, I joined Good Doctor Technology for about 3 years. But prior to that, I think 5 years ago, my mother was actually diagnosed with lung cancer. And in
Mm.
Singapore, so,
Mm-hmm.
and I still have that vivid kind of memory when we first got that X-ray and we saw, a huge lump on her lung. And it was from a GP clinic, right? And we were so frazzled, and we were running around to different hospitals to try to get an opinion for her. And just
Mm-hmm.
imagine in Singapore, when we went to a public hospital, it was so crowded. It was
Mm-hmm.
so many rooms. You really
Mm-hmm.
don't know where to go and who to look out for. And imagine
Mm.
at that time of emotional stress,
Yeah.
it was really, really stressful for me and my parents. But I think the kicker for me was we got a appointment with this specialist. Is again in a public hospital. We went there because it was not an appointment that we made for a very long time. It was a very compressed appointment. It was something that we wanted quickly. So we waited for 3 hours, went into the clinic. The doctor took a look at the X-ray, and he said that, look, I'm a cardiologist. Your mom's lump is in the lungs, although it's near the heart, but there's no way I can have an opinion about it. And
Mm.
it's within 3 minutes, and then we realized that we had the wrong specialist to
Oh.
read my mother's X-ray.
Mm.
So I think really at that time, I think to myself, there must be a better way of doing healthcare, a better way where patients in times of need have someone at the tip of their fingertips, at the tip that they can consult quickly, have an opinion, and then be referred to the correct doctor. So, I'm within that time, of my mom's treatment, where we have the clinical data and things. And also what occurred to me was that patients really need their own data accessible by themselves at any
Yeah.
time that they want, right? Because when you are tagged to a particular specialist, the specialist actually hold your data. And if you want your reports and data, you have to go to the specialist and ask. And sometimes it's a little bit, you feel a little bad because you want to go for third or second or third or fourth opinion. But the data lies within your initial primary care specialist, but it's not with you. So I think healthcare is something that is close to me, and that I feel that, with this experience, and of course, after talking to different stakeholders within the industry, you realize that it is an industry that we can disrupt, and it's an industry that we can make it better. It's an industry that we can use technology to make it more accessible. And especially this is something, which I want Good Doctor to be, is eventually to have a way where all our users and our patients on our ecosystem will have easy access to their own data to make informed choices. And then, of course, for our doctors and our partners to offer them the best care. So that's a nutshell. I know we ramble a little bit on about my
No. This is not, no, Melvin, this is not rambling. This is actually to the point. I mean, I think everyone listening can relate to your story. I myself have had to take care of my father, who sadly had passed away, and we in Thailand also have. I mean, if you say, in terms of healthcare systems, I mean, we are okay in terms of our standards, but there's always that issue of knowing the right person and going through public hospitals. I've been through there as well. It's like a war zone. And then like even the private hospitals are a battle as well. Even if you have insurance, there's always that issue of who do you see, who is the best, a person that is most appropriate for your case. And
Yes,
everybody,
yes.
I mean, if we could, be able to enable, ease in terms of ordering food, getting your coffee right, why can't we get that
Yeah,
same experience with healthcare, which is
yes.
so important to everyone.
Yes.
Before I think I'm going to switch it up, our talking points a bit with what I just talked about in
Mm-hmm.
terms of, we agreed to talk about ecosystems and everything, but I want to ask, skip to the point of your strategy then,
Mm-hmm.
let's get to the nitty gritty of, the biggest challenge I think for a lot of companies who are in health tech is, how do you work around, or how do you collaborate, or how do you find that that sweet spot in where you can have really efficient collaboration between the government, corporations,
Yes.
and hospitals. What
Yes.
is your strategy?
Yeah, and that's a fantastic question. And I think this is one of the big challenges wherever we go, right? Whether is it in Thailand, whether it's in Indonesia, or other markets that we may go to, and working with stakeholders is important. But I think the other one, I will touch on that later. But I think the most important one is to really first really address the knowledge gap about telemedicine, about virtual health. I think that's what we see when we went in fact in Thailand or Indonesia, that people are not exactly well versed with what telemedicine means, or
Mhm.
what virtual healthcare means, right? And usually we would take quite a long time to try to educate the market, educate the patients, educate various stakeholders. But fortunately or unfortunately, COVID actually helped us a lot. I think
Mm.
COVID, this COVID pandemic has really brought the learning curve or the knowledge curve of telemedicine and compress it, right? Within, like, say 5 years, within a couple of months, right? That now it is previously, 12 or 18 months ago, with the onset of this pandemic, it became so apparent how telemedicine or how virtual healthcare can really help alleviate certain gaps within the health ecosystem that was quite glaring during this pandemic, right? We talked
Mhm.
about how hospitals, whether is it private, whether is it public, it became more like, as you put it, like a war zone during the COVID pandemic. It's everybody crowds in hospitals. But what that means is also then means the transmission of the virus exponentially grows, right? So I think then governments then realize that they need what I call a gatekeeper, a triage, a particular stakeholder within the whole ecosystem that can efficiently triage patients, which means that if you have really very minor symptoms, please don't go to the clinics or don't go to the hospitals. You can use telemedicine to treat it, and we can deliver the medicine to you. I think that's the first layer. And then the second layer, where after governments and the public knows a little bit more about the virus, how it spreads, and as
Mhm.
vaccination rates go up, and
Mm.
then governments then have decided to use, whether is it self-isolation or whether is it home isolation, as an effective way to treat very minor COVID cases. And I think that's where telemedicine and ourselves really shine, because we were able to do that very effectively. And I'm very happy that the Thai government was also very progressive in engaging telemedicine providers like us to participate in home isolation programs, right? And we were very lucky that, as a very young company, in Thailand, and at that time we were only like 6 months old, that the NHSO, or the support social, right, have asked us to participate in the home isolation. And within just a short span of time, we were one of the largest acceptance of patients within central Bangkok. And we had numerous good feedback from the patients who used us. So I think what the pandemic has done is show the various stakeholders and authorities and governments that telemedicine is a integral part of the whole healthcare ecosystem. And that's where we continue to engage various stakeholders, like the governments. And of course, at the onset, we mentioned that our strategy has always been an ecosystem strategy, which means that our technology, our systems would be easily integrated into different partners' systems, right? If they have a system, we can easily integrate to them. Because if you think about it, virtual healthcare and telemedicine from our data, and as well as from the data of our shareholders in China, that only roughly about 36% of people or patients that come on the platform that we can effectively treat them. Only 36%. The rest, we actually have to refer them, whether is it to external specialists or whether to hospitals or clinics or labs. Because, you know, one of the great fears of some of the medical stakeholders is that they fear that telemedicine will replace them totally in future. But that's not how we see it. We see as telemedicine as amplifying the effectiveness of offline healthcare, right? Our thinking of an ecosystem and a virtual healthcare play has always been an O2O, online, offline, offline, online. It is never to exist in isolation. It is always with the view of partnering with different like-minded offline stakeholder partners as well. So whether it's hospitals, clinics, pharmacies, merchant partners, the whole works, right? So as I said, right, 36% only can be treated on the platform. The rest we have to refer, and that is the reality, right, of telemedicine and virtual healthcare, at least for the foreseeable future.
Some actually, you know, just the references is more than enough for a lot of family members who have to seek specialized medical care. You know, as we were talking about, you know, at the very beginning, you may not even know which direction to go to, and that's what I think a lot of people just need. But having, just as you mentioned, just having entered the Thai market about a year ago, you've mentioned about your journey a little bit, but how has it been overall, and what were the challenges that you faced? And was that one of the biggest challenges in terms of, you know, getting everybody on board and understanding how your company can assist the current medical system?
Yeah, I think it is really the knowledge gap that we are trying to bridge, right? It is it's always the frequent sort of education of the market, of patients as well, and of users, of what telemedicine means, the expectations of telemedicine, what it can do, what it can't do, and how we can be effective as well. You know, for us, our primary model is a chat-based model, right? You know, people are so used to video consult, like how we use video, you know, to chat and things like that. But our primary model is chat-based, you know, and I think, you know, for chat-based, there are numerous advantages of chat-based consult as well. It means that, you know, people, somehow I feel, you know, in a lot of our societies in Southeast Asia, chatting always have this form of closeness and also, you know, like a friendliness towards the people you are chatting with. It's something people, it's already ingrained in them. So by using a chat-based system, we felt that it will also lower their knowledge gap as well, because it becomes easier to talk to our doctors. And the other one, as I said, you know, pre-COVID, because we launched in Thailand during COVID, so it's a little bit different. But when we launched in Indonesia pre-COVID, I think there was, as I said, a lot of skepticism. There was a lot of worry as well, that we are here to replace a lot of things. And because one of the key things that we use, the technology that we use, is artificial intelligence. There's AI. And that enables us to really bring our costs down and to serve more people at a single time. But I think with AI, you know, a lot of medical practitioners become worried because they are worried that, you know, AI suddenly replaces doctors. But
Yeah.
That is not the case. I think what we see AI, and I always like to give this example of a previous colleague of mine who was a orthopedic, he was a doctor as well, and he always
Mhm.
put this frame this very nicely, and he said that imagine Iron Man, the Marvel Iron Man.
Yes. Yes.
Iron Man has the suit, but and of course Iron Man does all the fighting and things like that, right? But what guides Iron Man is actually the voice in his helmet, which is actually Jarvis. And Jarvis is actually an AI system, right?
Yeah.
That tells him, oh, the enemy is 350 meters away, or his missiles is low and things like that. So we liken AI as Jarvis to our doctors. Our AI actually is similar to an offline clinic setting where it consolidates your symptoms, it asks about your weight, your blood pressure, and things like that. So the AI actually aids the doctor in making more effective diagnosis, more effective recommendations, and also highlights things that the doctors may miss. But eventually, the consultations, the decisions, and the recommendation and the diagnosis primarily and fully falls onto the doctor's judgment. So AI
Yeah.
is just a tool for the doctors to use to make our consultations more effective and efficient.
I have to say that's a very good example, because a lot of our listeners, people who are reading or followers of Techsauce, are Marvel fans. Uh,
I hope they're
but
Iron Man fan and not Captain
yeah,
America fans.
our CEO is also a Marvel fan. Um, but you talk about AI. That was one of the things I wanted to ask you about, because when you talk about consumer adoption, it's a very tricky thing, because I myself sometimes struggle with speaking or chatting with AI as well, because the consumer kind of knows in a way, and in terms of, if you have a really pressing issue, you kind of would want to speak to a person, or to
Yes,
connect with a person. How
yes,
how do you go?
yeah,
How do you solve this
yeah.
problem?
No, so as I said, right? I mean, for us, when you come into our app, please be assured that you are always talking to a medical professional. The AI, as I said, is always at the start, where it tends to gather all your necessary information before the doctors take over, and
Mm-hmm.
so that it saves the doctor's time. So imagine, right? Even if you go to a specialist clinic or you go to a hospital, before you see the doctor, there will always be a nurse
Mm-hmm.
or a someone in the clinic that either take your temperature, take your weight, ask about your symptoms, if you have fever, how long has it been, and take your blood pressure, and then put it in a card, and then before you go to see the doctor. It's no different here. That's what we intend to do. AI takes time to be implemented. So it's coming to Thailand. We implemented AI in Indonesia, but in Thailand, we still take time. You still need to have lots of data to be able to train the algorithm. So in Thailand, we are still young. So as of now, when you come into our app and talk and initiate a consultation, it's really through talking to a medical professional, and the AI comes later, as I said, to really
Mm-hmm.
help the doctors as well.
Now, when you talk about Southeast Asia, in whatever industry you're in, there's always the issue of, we are a one region, but so different at the same time. If you talk about the economy, people living in Vietnam are experiencing different social economic situations to that of in Singapore or in Thailand. How do you strategize, or how do you adapt to the different ecosystems in the region?
Yeah. So we are in an industry that is very sensitive. I think healthcare is a very sensitive, also a very emotional kind of industry to be in. So what we usually do is that when we enter a new market, we partner with like-minded companies. Now, look, our strategy is really threefold, right? We are predominantly a B2B and enterprise kind of company, so that's one. We also look at health services, health service as a health services or health solutions as a service, HSAAS, where we plug in into ecosystems and provide the necessary medical and healthcare, and working with the governments. So that has always been our strategy. Going in with partners in the market who understand the intricacies of the health ecosystem. We will send people into the various markets to really understand the regulations, because as I said, telemedicine is new. Some countries have stringent regulations, some countries don't have regulations. So we need to understand that. And of course, also understand, the type of data privacy and data infrastructure that each country has, right? Because when you are in when you're in industry like healthcare, data privacy, data security is very, very key, right? For us, where we operate, we have physical servers in the country. None of the data is being transmitted elsewhere. It stays in the country. That is what we have always, the philosophy of our data protection. So I think that coupled with partners, coupled with data privacy and the respect of regulations, governments and stakeholders are usually very keen to work with us. And I think that gives us a huge advantage when we go into different markets.
Now, you mentioned before that, the issue of, the pandemic really did showcase the capabilities of your company. But then how do you transition that to the future, or how do you apply what you have done to what we're going to be seeing in the future trends of health tech? And speaking about the future trends, where do you see your company going, and where do you see the whole health tech sector going in the future?
Yeah, so I think the pandemic highlighted the bread and butter of telemedicine. And the bread and butter of telemedicine is really sick care, right? When somebody is ill, somebody has a symptom, flu, headache, fever, they come into a platform to chat with doctors, get their medicine, and then get well. But I think the long-term play for health tech companies or telemedicine companies like ours is really twofold. One is preventive care. Preventive care is a huge umbrella. It means wellness. It means, having tools to really monitor your health, having tools to live healthily. So I think that will be one of the largest focus for telemedicine companies, and us including, right? And including the governments as well. I think they will put a lot of money, a lot of budget, a lot of resources into preventive health, right? Preventing citizens from becoming sick, getting citizens to live healthily, because healthcare cost is ballooning, right? I speak especially, where Singapore is. We see healthcare costs ballooning, and in various Southeast Asian countries as well. So preventive care is one. The other one, that what we want to do is, how do we manage chronic disease? I think, or I can say in Singapore again, diabetes is one of the number one chronic disease in Singapore. I think in Thailand as well, diabetes, high blood pressure. How do we treat those? How do we use telemedicine as a way to enable chronic disease sufferers to be able to get their medicine more effectively, able to follow certain plans so that their ailments are reduced or even cured, like for certain diabetes conditions, diabetes type 2 is temporary actually. So if you have a proper meal plan, lower your sugar intake, your calorie intake, you do some exercises, you can actually get better and recover from this sort of diabetic conditions. So there's something that we want to focus on as well. So preventive healthcare and chronic diseases, I think these two will keep virtual healthcare platforms busy at least for the next 5 years, I guess.
I think the opportunities are definitely there, as you just mentioned. And thank you for talking about that, because I think a lot of people who are interested into following your footsteps or going into health tech would want to know what to look out for, where to focus on. Do you have any further advice for those who are listening that are startups or companies that are looking into getting into health tech?
Yeah, I think one thing, one if that's one advice that I can give. I mean, we are very new in the market. We have not, um, we have about 10 years, 15 years where I can give a lot of useful advice. But I think one advice is really, you must be passionate about healthcare. Because I think, if you go in with the mentality that I want to scale it very quickly, I want to be like ride-hailing companies or food delivery companies where I can scale, and then if I have a lot of capital, I throw a lot of coupons and promotions, you will be successful. I think you're in for a rude shock. The healthcare market, healthcare system is very different. The heart must be in the right place. And you don't need to have experience in healthcare. I think everyone has certain personal experiences when they either go see a GP or bring loved ones like myself or even yourself as a caregiver. You probably have experiences in this field. So if you're passionate about it and you think that something that you want to be involved and change it, and really improve it, then I think it is an industry for you to pursue further.
Wow. And lastly, would you like to, give any, if people who want to contact you or work with your company, how can they get in touch with you?
I think one of the best ways is to really get their HR, because as I said, right, we are predominantly a B2B and enterprise focused company. So if you are in a company and if you want to make sure that you have health and wellness benefits that encompasses telemedicine as well, please contact your HR and get them to contact my colleagues in Thailand, and we are more than happy to provide more information.
Okay, and definitely for those who are listening and want to know more about Good Doctor Technology and Melvin Vu, you can always contact us here on Techsauce at our website. And of course, we'll have more updates on what's going to happen in health tech, as well as from Melvin Vu. Thank you so much for being with us here today. I think a lot of people, I myself, gained a lot from our conversation. Thank you so much, Ka.
Thank you so much, Kumpope. Thank you.
Techsauce, sparking innovative thoughts.